Hey guys, welcome to Southern California EMS Training Institute. My name is Tyler Andrews, and in this video today we're going to be talking about epinephrine and how to administer an EpiPen to our patients. First off, our EpiPens do come in a couple different varieties. Some might be known as your auto-inject, your twin-inject, your EpiPen, but most of them will have similar features. Our epinephrine is going to be used for any patient who's experiencing a severe allergic reaction or anaphylaxis. Anaphylaxis is a severe allergic reaction with signs and symptoms of shock and or including respiratory distress. So we're really looking for those signs and symptoms in our patient when we're going to be moving to our epinephrine administration. Not every allergic reaction actually needs epinephrine. Only those with severe allergic reactions with signs and symptoms of respiratory distress and or shock. So that's, again, what we're looking for. Our epinephrine comes in two doses. Specifically, either comes for an adult, where it comes in 0.3 milligrams, or it comes for pediatrics at 0.15 milligrams. You won't get to decide. It will either be coming as maybe an EpiPen or maybe an EpiPen Junior for the pediatric dose. This is an intramuscular drug, which means it's going to be injected actually into the muscle, and we go into the outer side of the thigh, known as the vastus lateralis. We're actually going to hold it in there and allow all that medication to actually distribute into the muscle, and we're actually going to massage the muscle too afterwards to help distribute that medications. Now, before we give this medication, there's a couple things we should be aware of. Some side effects of this medication: it is a what we call sympathomimetic, or it mimics the effects of your sympathetic nervous system. So it will make this patient a little bit tachycardic, a little anxious, a little restless, maybe have a little bit of tremors. Be aware for some side effects like that. And there's absolutely no contraindications for this medication, although we should be calling medical directions before we administer. Now, when we administer our epinephrine, what we're going to do is we're going to tell our patient, right, hey, we're going to be going to administer your patient's EpiPen. Our EpiPen can be carried with us in our rig or maybe in your med bag, or it can actually be administered to the patient, and you can assist them with their own prescribed EpiPen. We're going to take our EpiPen, we're going to make sure we do our 6 writes and D-dice, and we have approval from medical direction. After that, we're going to make sure we can either expose the outer portion of my patient's thigh, but your EpiPen can go through larger clothes if they have jeans or something on. Make sure there's nothing in their pockets, because you don't want to go through a pocket and hit something in their pocket. We're going to find the outer part of the patient's thigh. We're going to go ahead and we're going to pull off our safety cap. The safety cap is typically in the rear. And then when you go ahead and grab your EpiPen, don't wrap your thumb around either side of it, because you might mistake what side the needle comes out of, in which case that needle will go through your thumb and your patient won't get any of your medication or their medication. This has happened, you guys. That's why we bring it up. So please, please, please don't wrap your finger around either side. Your safety cap will engage the needle. In which case, once that safety cap comes off, right, the needle typically comes out of the other end. If you're ever not sure, follow the directions on the EpiPen to make sure you don't mess it up. Once we have our epinephrine in hand, we're going to go ahead and we're going to push it into the patient's outer thigh, right? And we should hear a click. So I'm going to go ahead and push this in my patient's outer thigh. And once I hear that click, I know it's been administered. Now, we follow the 10, 10, and 10 rule when we're administering epinephrine, which means we do 10 inches above the knee or 10 inches below the hip. And then we're going to go ahead and hold it inside the patient's leg for 10 seconds to make sure we administer all of that medication into my patient's muscle. After we're done with that, we're going to go ahead and we're going to sharps this. This is now a sharps and needs to be placed in a sharps container. And we're going to go ahead and massage my patient's leg for 10 seconds. So that 10, 10, and 10 rule is, again, we're going to go ahead 10 inches above the knee or 10 inches below the thigh or hip into the outer portion of the thigh. Hold in for 10 seconds in the patient's leg, massage for 10 seconds, make sure this goes in a sharps container. After that, we're going to reassess my patient for any changes in their vital signs, changes in their maybe any issues with their shock or cardiovascular compromise. We're going to be looking at the respiratory rate, and we're looking for any changes in the respirations, but we will be reassessing our patients. Now, epinephrine is a short-acting medication, which means their signs and symptoms of anaphylaxis might return, in which case if the patient has to, or if you carry to, if you start to see signs and symptoms of allergic reaction, severe allergic reaction return, you may re-administer a second dose. Please do not forget to contact medical direction for approval, even for that second dose. that's a little bit about epinephrine and your EpiPen here. Again, this is Southern California EMS Training Institute. Thank you guys very much.